So let me carry on filling out my PHQ9. Sorry about the technical difficulties just there. Now the next one is feeling down, depressed or hopeless. Now again, this is a very characteristic feature of depression. Feeling down, low mood, depression. And this feeling of hopelessness is a big problem in depression, because when someone's depressed, they've come to realise to varying degrees that there's no hope for them anymore. So if there's no hope, then there's no point trying. There's no point going to the doctor to get help. There's no point trying to see a psychiatric nurse or counsellor to get help. There's no point taking medicine to try and help, because, you see, my situation is hopeless. There is no hope for me, so why bother trying? But of course there is. There's any amount of hope. So people around them have to realise that someone's feeling hopeless and help them and support them to seek advice, or help them and support them through this difficulty. So this feeling of helplessness, helplessness is very much part of depression. So that's how am I feeling now? Feeling down, depressed, hopeless. Well, sometimes I don't feel brilliant, but I do see hope in things at the moment. So I'm going to go for not at all on that one at the moment. Now the next one relates to sleep. Trouble falling or staying asleep, or sleeping too much. Now, sleep disorder is incredibly common in depression. Sometimes it's difficult to get to sleep. But what I found in a depressive period was I would work all day and I'd be so tired I'd get off to sleep. But then I'd wake up about 4 o'clock in the morning. It was really annoying. I had this early morning waking, and of course that made you tired as well. So sleep disturbance is very much part of depression, and of course sleep is essential to mental health and well-being, and all health and well-being. So when you're depressed and you can't sleep, and then the lack of sleep makes you more depressed, and you get into kind of a bit of a vicious circle, really. So that's very characteristic in depression, particularly the early morning waking. Trouble falling or staying asleep. Do I get that? I still get that sometimes. Sometimes I get that. I wake up too early and I can't get back to sleep sometimes. Feeling tired and having little energy. Well, again, this is common in depression. This lethargy, this feeling tired, just no energy, can't be bothered doing things. It's partly caused by the lack of interest. And I have various days. Sometimes I'll go out for a walk or walk uphill, and other days I think I just can't be bothered doing this today. So again, it's kind of normal, but in depression it's extenuated. It's worse than normal. So let me see. Feeling tired or having little energy. Yeah, I do get that sometimes. It's not too bad today, but poor appetite or overeating. Well, I don't often have trouble with poor appetite, but I do sometimes overeat. Now, I think my overeating is probably just due to pure gluttony, to be quite honest. But some people eat as a response to their mood. I don't think I really do that. So is your eating determined by your mood, really, I think is the question here. Because some people comfort eat. So poor appetite or overeating, I think I'll say no to that one. Feeling bad about yourself of that you have failed or let yourself or your family down. So we see that talking about depression here becomes highly personal. But it's things that we need to talk about, because actually everyone suffers from this. So maybe you're feeling bad, maybe you feel you've failed, maybe you're feeling you let people down. Well, that's a depressive feature. That is part of depression. So realise that this might be part of depression. Feeling bad about yourself, or that you've failed, or have let yourself and family down. No, I've certainly had that. As of today, and remember we're feeling this in for today, I'm going to put not at all, because, well, several days. So you can and ah about these. I'm going to leave it at not at all for now. I don't feel too bad about that at the moment. Trouble concentrating on things such as reading newspapers or watching television. So concentration difficulties is a feature of depression. If you can't focus on things, then that could be partly because that you are depressed. Do I get that? Not too bad at the moment, I think it has to be said. Moving or speaking slowly so that other people could have noticed. Now, in psychiatry, this is called psychomotor retardation. So psycho means mind, motor's movement. People can be thinking slowly and moving slowly, and this is a feature of depression. I've seen people that are very depressed and they'll just walk in really slowly, and when you talk to them, there's a delay. Their thinking is slowed down. This psychomotor retardation, it's a depressive feature. So if you've got that or you've noticed that in someone else, think about that. Is that a feature of depression? Or the opposite is being so fidgety and restless that you've been moving around a lot more than usual. Now this can be associated with anxiety, but again, people often overcompensate in depression. So they're feeling depressed, but they're running around at 90 to the dozen to try and compensate for their depression. There can be this overcompensation type thing, which is also a feature of depression. And of course, there is such a thing as smiling depression as well. Someone is deliberately giving the impression, oh, everything's fine, but in actual fact, inside there's a wretchedness, a smiling depression, and that's quite common as well. Look for that in the people around about you. So I'm filling this out for me, aren't I? So moving, speaking slowly, no, not really. Or the opposite, fidgeting around, not really, no. Now, thoughts that you would be better off dead or hurting yourself in some way. Now, I must say I have never had that, but I know people who have, and I've looked after many people who have. Now, if you feel that you want to hurt yourself, or worse, if you're feeling suicidal, this, of course, is an emergency, and you must tell someone straight away. Because I've known people who don't have people to communicate with, and they do, in fact, commit suicide. Suicide is more common in people that live alone. So you must always communicate with people if that is how you're feeling. So at the moment, my depressive score is 3 out of 27. So we see that 0 to 4 means at the moment I'm not depressed. If the score was 5 to 9, I would have had mild depression. If it was 10 to 14, I would have had moderate depression. 15 to 19, moderate to severe, and 20 to 27 would indicate severe depression. So what I'm going to do now is I'm going to write this on my diary here. So my PHQ-9 score for today, Sunday the 17th, is 3, which isn't too bad. So I'm quite happy with that, really. And we're going to see. We can see what it is later in the week. We'll keep a tally on this, because remember, you can have good days and you can have bad days, as we've said. Now, to be fair, other times when I have been depressed, and you can probably relate to this, then there's been times when I've lost interest in things for more than half the time, feeling down, depressed and hopeless. Yeah, I've felt that. Maybe you have. Trouble staying or falling asleep. Yeah, I do get that. I was waking up fairly regularly, certainly several days. Feeling tired or having little energy to some extent, yeah. Poor appetite or overeating. I'm not really a compensating eater. Feeling bad about yourself or feeling you've let people down, certainly had that. Trouble in concentrating, certainly had that. Speaking or moving slowly, no, not at all. Hurting myself, no, I haven't had that. So you can see recently, just a few years ago I had this episode. Okay, that's a mildish depression there, but But I was certainly scoring on that PHQ-9 score. So if you're feeling fine, I actually think it's quite a good idea to look up that PHQ-9 and fill it out, because it is a very useful tool, and then you can compare that to other times. And if there's someone you're worried about, sit down and do a PHQ-9, and then if you ring your doctor up and say, look, my PHQ-9 is 12, he'll know what you're talking about, and you can get he can give you immediate help for that. So that's what I find useful, doing that. It gets you thinking about yourself a bit. It's not self-indulgent. It is appropriate to think about yourself quite regularly. That's fine, as long as you don't do it all the time. You've got to think about other people, or think about the people around about you. So, I'm able to keep my own diary at the moment because I'm not feeling too bad. So I'm just going to keep my own this week. But I'll keep it all week and see how I go. As it is a difficult time for many people. So that's the depression score. So I find it useful to have that. It just gives you some sort of degree of self-awareness, really, because again, in depression, a big part of it is that you lose the ability to be objective about yourself. And if you see other people with that kind of difficulty, fill out the PHQ-9 and say, look, I know you're feeling bad, but this score is saying that you have a level of depression. And that may well mean that you're not thinking about yourself objectively. You might think that you are a worse person than you actually are. And when you realise that, it's when you realise that you can get help. And there are help strategies that work. So, for example, there is evidence that various talking therapies work, such as cognitive behaviour therapy. There's evidence that these things work. There is evidence that antidepressant drugs, such as selective serotonin reuptake inhibitors, the SSRI drugs like fluoxetine, which is Prozac, there's evidence that these drugs work. They actually work. Because the reason that someone is depressed, it's partly what's going on round about them, but it's what's going on round about you is making you feel depressed because it's affecting the chemistry in your brain. And there are drugs which can moderate that chemistry in your brain and can improve it, and can improve mood and can restore objectivity. And as long as antidepressants are used properly under medical supervision, they can be very effective drugs. So that is the thinking about depression. Now, another issue that's remarkably common is anxiety. And there's this thing called generalized anxiety disorder, or GAD. And the current score we're using to assess that is called the GAD-7. Now, to me, there's basically two forms of anxiety. There's anxiety which is a perfectly natural response to an external threat, either for yourself or someone that you are concerned about. There's a real danger in the real world that causes anxiety. So if there was people trying to break in to attack me, to hurt me or kill me now, of course I would have anxiety. That's a natural response. It's necessary for self-preservation. The trouble is that these stressful situations can sometimes go on for a long period of time, and there can be anxiety for a long period of time, which becomes very, very stressful. And I've just lost my train of thought because I've just remembered something else about depression. I'm going to tell you it now. Just another feature of depression I meant to mention is anger. When I was depressed, I got angry at things. So if people are becoming angry, think of that as depression as well. Can be anxiety as well, but unusual anger can be a depressive feature. So anyway, getting back to talking about anxiety. There's this anxiety which is proportionate to the external threat, perfectly normal. Essential, because if you weren't frightened of things, you'd go around doing stupid things and kill yourself. But there's anxiety which is disproportionate to the external threat. And sometimes I've just been sitting there, no external threat, and think, just a minute, I feel anxious. It's like a free-floating anxiety. And it's actually very common. you've probably had this. People around you will have had this. It's just that people don't normally tell you about it because people have difficulty talking about the way they feel. It's a difficult thing to do. So there's this anxiety which is disproportionate to the external threat. And that's when anxiety becomes abnormal. So let's look at this tool again. And again, I find this helpful. So again, this has been well attested. So feeling nervous, anxious, or on edge, as if something bad is about to happen. Do you often get that feeling that something bad is about to happen? You're on edge, you're tense. Well, let me fill this in for me. Feeling nervous, anxious. Yeah, I sometimes get that. Several days I get that. Obviously that would count as 1. More than half the days would count as 2. Nearly every day would count as 3, making our anxiety score more serious. Not being able to stop or control worrying. Worrying which is beyond your ability to switch off, that you are constantly worried about something or many things or situations, or you can be worried but not about anything specific. You just feel this emotion of worry, which is part of the anxiety, but it's not actually focused on anything. But it's just as real. Very frustrating because you're worried, but there might not be anything that you're particularly worried about, but it doesn't alter the fact that the worry is real. This is part of this generalized anxiety disorder. So not being able to stop or control worrying. Am I getting that just now? Maybe not too much just now. Certainly had it in the past. Worried too much about different things. Well, yeah, I still do that. Worry quite a lot about different things. A range of things. Or indeed nothing. This is the frustrating thing. Right, do I have trouble relaxing? That you just can't seem to switch off. That your mind is constantly running through scenarios and possibilities of things that might happen, that you are constantly crossing your bridges before you come to them. If you are, that can be a sign of generalized anxiety disorder and is therefore amenable to treatment, because just as depression can be treated, make no mistake, this anxiety disorder can be treated as well. And it's treated in much the same way as depression. It's treated by talking therapies, cognitive behavior therapy and others. But it can also be treated by antidepressants. So antidepressants, as well as treating depression, are also very good for treating anxiety. So again, there's pharmacological treatments available that do work. There are non-pharmacological treatments available that do work. There is great hope in this situation for things to move forward. Trouble relaxing. Do I have trouble relaxing? Yeah, sometimes. Being so restless that it's hard to sit still. Now, again, this restlessness is part of anxiety. So you might relate to times when you were anxious and you just can't sit still. We sometimes call this pacing the floor. You're kind of walking up and down all day. And this is a stress reaction that you can't sit still. You're pacing the floor because your anxiety won't let you sit still. That's abnormal. You are supposed to be able to rest physically as well as rest mentally. So if that's the situation you're in, that could be a feature of generalized anxiety disorder, GAD. Have I got that just now? No, not really. I can actually relax physically at the moment, so I'm quite happy with that. Becoming easily annoyed or irritable. As I was saying before, the anger can be part of depression, that little things just seem to set you off, that you can feel yourself getting tense inside and cross with people or cross with yourself. You know, you're annoyed or easily irritable. Well, that is a feature of generalized anxiety disorder. And I've certainly had that in the past, and I'm sure you have, and I'm sure you've seen people around you who have had that. I haven't particularly got it just now, so as of now, I'm not too bad. Feeling as if something awful might happen. Part of anxiety is this feeling of dread. I am just about to die. I am just about to have a heart attack. My friend is just about to crash in his aeroplane. Someone I love is about to get a terrible disease and die. These things that, of course, could happen, but in the balance of probabilities aren't very likely. So feeling afraid that something absolutely awful is about to happen. Well, if that's what you're feeling, that's part of generalized anxiety disorder. Remember, that's what we're measuring. GAD, generalized anxiety disorder. So my score at the moment is 3. So again, 3 is going to indicate the GAD-7 score is calculated. So we know it's 1, 2, 3 for these things that count. So the scores are 5, 10 and 15 for no anxiety, moderate anxiety and severe anxiety. So mild under 5, moderate 5 to 10, severe anxiety over 15. And again, if I'll do this for myself, when I have had anxiety problems in the past, feeling nervous, anxious on edge, yeah, sometimes that was really quite a common problem. Not being able to stop worrying or control worrying, yeah, I've had that. Worrying too much about different things, yeah, I'd say that's true. Trouble relaxing, probably not so much. Not being able to stop, sometimes you have to go back and kind of correct yourself a bit because you're not quite honest with yourself. Trouble relaxing. Certainly had that. Not being able to, worrying too much about different things. Yeah, probably that one. That one's probably about right. Difficulty sitting still. Yeah, I've had that. Becoming easily annoyed or irritable. Oh, well, yeah. Yeah. When I'm anxious or depressed, I do get quite a bit of anger. This one, yeah, to some extent. So when I've been in not so good territories, I've been had moderate anxiety disorder. Sometimes, maybe even a bit worse than that. So there we are. I just find those really useful. I mean, I'm just telling you what's helped me. I just find them really useful to give insight. So my GAD score today happens to be 3 as well. I didn't plan this; it's just the way it's worked out. So again, keeping a record of that and keeping a record of that over time. And again, it's very good for communicating with your healthcare provider. So if you can say, well, my PHQ-9 depression score is 12 and my general anxiety score is 14, then it looks like you've got sort of depression anxiety disorder, and that would require some treatment, and it can be treated. And again, when someone's anxious, especially if they haven't had treatment for it before, it's very hard for them to realize that anxiety can be treated, because people that are anxious have this feeling that their anxiety is just part of them and can't be treated. But antidepressants such as selective serotonin reuptake inhibitors work very well for anxiety as well as working for depression, and there's evidence for this. Cognitive behavior therapy works very well for anxiety as well as depression. These treatments actually work, and you can be restored to a normal mind. or the person around you who feels that there is no hope, who feels that their anxiety is intractable, can be restored to a normal mind. But it depends on these assessments first of all. So I just find that remarkably useful. And as well as that, if you keep this kind of diary, then it helps you communicate with those around you. So you can say, when I had an anxiety episode. And even those closest to you, it's remarkably difficult to say, you know what, I'm anxious. Because people always say, well, what about? What are you anxious about? You're okay, well, what are you anxious about? But of course, with generalized anxiety disorder, you don't need to be anxious about anything. You're just anxious. So it's quite possible in people, this natural worries about this pandemic, natural worries about things that are going to happen to them and their family, normal depressive reactions and normal anxiety reactions actually become almost entrenched behaviours and habit, and can be a self-perpetuating thing that can need treatment and other people to talk to help. So try and talk to people. Most people, not everyone, I know that, but most people have got someone they can trust to talk to. So tell them how you're feeling. And if you've got a group of people you can tell, so much the better. Don't keep anxiety and depression a secret, because it responds to help from other people. It responds to help from professionals, and it also responds to medication. But just letting those around you know you've got problems with anxiety and depression, once someone knows you have anxiety, that can actually be quite a relief that people, that people around you know and will help you. And again, look out for it in those around you also. Now, that's what I want to say about anxiety and depression. Now, it's kind of difficult to know how much to disclose on this video. But I am going to tell you, sometimes I drink alcohol. Quite a few people drink alcohol from time to time. And I've worked with many fit young people. And I've done this with literally hundreds of student nurses. What I do is explain to them how to work out units of alcohol. Now, I'm not going to do that now, but basically a unit of alcohol is one drink. So a unit of alcohol is 10 mils of pure ethanol. I'm not going to show you how to work it out now. I'll do it separately. But so a pint of beer is 2 drinks. So these units are well known, and you can look them up. So work out how much you're drinking. So what I do is I got all my students to work out how many units of alcohol they're drinking. And of course, we're not supposed to drink more than 14 units of alcohol a week. And very, very many times, and this is with young fit people, the reaction's been, dear, have I drank that much last week? I didn't realise that. Because they'll maybe have a drink on Monday, then nothing on Tuesday, then they'll have a few drinks on a Friday night, then they'll get a bit drunk on a Saturday. And it adds up to way more than they think. So again, it's having this insight into how much alcohol you're drinking. And especially at the moment, where people might be shut in and they're anxious, then alcohol's a quick fix, because of course when you drink you feel better straight away, but then you feel worse for a long time. And make no mistake, and alcohol makes anxiety and depression worse in the long run. So someone who's not anxious or depressed, if they start drinking a lot of alcohol, they're probably going to become anxious and depressed. You get these rebound effects. So what do we do about this? Well, there's evidence, and good evidence, that people that know how much they're drinking and are aware of their drinking and have good self-awareness of their drinking are likely to drink less. So the first thing is to establish awareness of your drinking. So what I do, and I suggest other people do as well, is I have an alcohol diary. So this is so I'm planning not to drink too much next week. Fairly busy week planned, but what we can do is I can look at what you can do is you can write down your drinks there. So today I've had no drinks at all, but suppose I have 2 cans of beer, 1 glass of wine, and then I have a rum and coke, which I don't think I'm going to do that today, but suppose I did that, and then you can work out the units. So a glass of wine's probably 2 units, a rum and coke's probably 2 units because I normally pour a fairly large one, and 2 cans of lager would be 4 units. So I probably drank 4, 5, 6, 7, 8 units just on that day. And remember, I'm only supposed to have 14 in the week. So if you keep that for every day of the week on an ongoing basis, then you can become aware of how much you're drinking. Because, as I say, I've worked with many people who've drank. When I was a student psychiatric nurse, the first 2 alcoholics I looked after when I was 19 years old both died, and I'd become really quite friendly with both of them. And they were, I was only 19, but these guys were only in their 20s and 30s. So looking back now, to me, they're very young men. And they died from their alcoholism. It's a real problem. And I actually believe that high levels of drinking is a disease. I believe alcoholism is a disease, and we need to have sympathy for people that have been drinking. So recently in my A&E work, people have come into A&E with alcohol problems after a drinking bout, perhaps been drinking heavily sometimes for weeks. And my reaction is to say, oh dear, I'm really sorry. You poor thing. You must have suffered a lot. Bless you. That's an awful thing to have had to go through. Even though they've been picking the glass up and pouring it down their own throats, I still see it as a disease, because these people can sometimes lose control of their drinking. And the question is, of course, do you control your drinking? It's one of these things where we need to have good insight, because, of course, alcohol is going to make it worse. So the Simple Drinks Diary has been demonstrated to reduce the amount of alcohol people drink. And that is a very simple thing that everyone can do. And, of course, as with all these psychological issues, whatever you do, don't keep drinking to yourself. Talk about it with people. Be as open about it as you can, because it is more common than you think. I know many, many people who have had drinking problems at various parts of their life. It is very, very common. So that's what I want to say today. So a bit of a look at depression and anxiety. Be aware of it in yourself. If you feel it, tell other people. Be aware of it in those around about you. And likewise for anxiety, and likewise for drinking alcohol. Be aware of it in yourself, have good self-awareness, and be aware of it and deal with these issues in conversation, openly, and non-judgmentally with others.